Brockton's emergency health services will be cut in half for at least the next 3 months while crews fix the fire and water damage at Brockton Hospital. WBZ's Juli McDonald is live outside the hospital now, which is closed. Juli, what happens to patients who need care?
Well, Lisa, even within the last half hour or so, a man pulled up here to the hospital closed sign. He was confused by that, didn't feel well, and was seeking care. He will drive a few miles down the road to Good Samaritan. But I did speak with a hospital volunteer earlier this evening. His concerns the same as many in this community. This is not just a Brockton problem. It affects many patients and many first responders across cities and towns.
A flashing sign deters patients outside a dark Brockton Hospital, which will stay that way for about 3 months. Signature Healthcare will open 2 new urgent care centers in the city over the next 2 weeks, but neighbors are worried about vulnerable populations who rely on their hospital care teams.
It's a concern. I mean, I think we're very fortunate of our distance to Boston and the fact that a lot of us can go to Boston for care. But you have a large elderly population here. You have certain populations that don't have access to Boston, and they don't have vehicles, and you know that's not a solution for them.
Patient volume has doubled at the city's only other emergency department at Good Samaritan Medical Center, but the strain trickles beyond Brockton. First responders across the region have already been burdened by no access to Norwood Hospital after that 2020 flood.
With the closure of 2 hospitals in our area has certainly created, don't want to call it a crisis yet, but you know, it's certainly building to that point.
Emergency responders in other towns are forced to increase their staffing because when crews rush to a call, they're traveling with that patient for much longer.
We're all transporting further away. We're going to Needham or into Boston. We do a lot of transports to Rhode Island now.
And so when the hospital does reopen, there will be limited inpatient services available, more services offered over time. The whole timeline really depends on how quickly crews can get access to the supplies they need for repairs. Live in Brockton tonight, I'm Juli McDonald, WBZ News.
All right, Juli, thank you.